So these are sticky. Okay. And we, like we said, we have, we apply 4 of the electrodes on the extremities. Okay. So we avoid bony prominences. Okay. Now, before anything else, before we apply the electrodes, okay, make sure that the patient is wiped, okay, to remove any oil, lotion, perfume. Yeah, he has to remove that watch. If you know, that's fine. But I'm going to put it higher. We also, you have to take off your shirt. It's just easier to. Okay. And then we also, like I said, if the patient is very hairy, you will need to shave his chest. Okay. Now, if it's a a very obese female, and she has pendulous breasts, you have to make sure that you stick the electrodes underneath the breast tissue. So you say, take the breast, flip it, okay, so that you can put it here. Put a sling over it. So it does not fall.
I've had to do that.
Okay.
No, I had to have another nurse like actually hold it for me because we needed 2 hands.
Oh.
She was big.
Okay. So we put the. So like I was saying, if for example you decide you want to put it here by the bicep, okay, then on the other side it has to be in the same area. You can't have one here and the other one there. I can also put it here below the clavicle. Let's say this patient does not have any extremities. Okay. In the 3-5 lead, they make use of this area below the clavicle. Okay. So we put it here. Now this one here, you will see there's a pointed end. It's like an arrow. They say that it should be pointing towards the heart. Okay. I say it depends on the patient. Okay. If, for example, you have a female patient with big breasts, if this were pointing downwards, when you attach your leads, the breasts will get in the way. Okay, so it's best if it's pointing up here. Now, if this is pointing up, the rest here is going to be pointing downwards.
So for test, we should do it out, pointing
So,
out.
no, for this one here, you just point it upwards.
Upwards.
If it were in the abdomen, upwards. And then the rest here will be
the
pointing
side.
downwards.
Downwards.
So, this will be for the lower extremities. Okay, I will put up. Excuse me. Okay, so again, your landmark will be your angle of Louis. So you have second ICS, third rib, third ICS, fourth rib, fourth ICS. So your V1 will be at the fourth ICS,
Going down.
right sternal border. Okay. Then you have V2 will be at the fourth ICS, left sternal border. We skip V3, we go to V4. So this is V4, this is fourth ICS, right? So you have the fifth rib, fifth ICS. So you have the V4 is fifth ICS, left mid-clavicular line. Okay. V3 will be between V2 and V4. V5 will be at the fifth ICS at left anterior axillary line. Can you see very well? Am I at anterior axillary? Okay. And then V6 will be at the left mid axillary. Excuse me, move. You'll see from there.
Lower. A little lower.
No, it's fine. Okay, so that's how it will be attached. Okay. We good?
So
Next.
all of them is Peripheral.
Because we will use we will run it. So these are your leads. And like I said, it has, this is the paper that I was talking about, so this was where your electrodes were attached. Do not toss this out, because after you're done, you stick it here and then count it. You should have 10. So you don't forget any of those electrodes on the patient. Okay, so we have, look at this. So it says LA, which means, okay, not Los Angeles, it's left arm. Okay. So this is what I was saying earlier. When you, if you are to do this test, it has to be, you have to prepare everything so that the wires will not be all tangled. So right arm, just clip it. Oops. Yes, thank you. Okay. And then you have, left leg. Okay. Right leg. And then we have, sorry, V1. Okay. You have V3. Okay. And then we have V4. Left arm. Left arm. Oops. See, it gets pulled. We'll just change that.
Why is it getting?
Yeah. He was probably a little sweaty and so.
Foil.
Oh, that Panda
From all-
Express.
V5. I will change that. And V2. Earlier it was this one here in the middle that was not. Maybe it's the
I think this is.
the sticky thing. Wait.
What's this one?
Does it work?
Which one?
The ECG.
Oh yeah.
It's so old.
Huh?
ECG.
No, it's not old.
No?
Are you gonna change this pattern?
Is it here?
Doctor has something.
Yes. So what about the other one? Is we stick with the other one on?
Which one?
Oh,
Oh my
Stop
gosh.
sweating, Andy.
I'm not sweating, I swear.
Maybe it's this one. Which one?
This one's
Oh wait.
I don't do anything.
There isn't. That's V6.
Coming off.
It's still coming off. Maybe it's the.
Seems like the rest of them are
I
coming
think
off.
it's the this. No.
Okay. And
V6.
V6.
Maybe it'll read.
Oh, this one's
Okay.
coming off.
So is the red one.
Oh,
It's
yeah.
coming off.
So just hold it for now,
Okay.
so that it does not. Okay.
This one's.
Teamwork, guys.
Maybe the brand is not very good. That's why. It's,
Yeah, it's not the.
okay. So we just. Okay.
As long as you don't touch it,
Do
you
we
like
have to do an extra one for the test?
Which one?
An extra one.
No, because you'll be doing that on the dummy.
Oh, okay.
No, wow.
Okay, let's see if
So
we
you
can-
have here
laugh,
now.
Laugh, laugh.
Yeah, giggle.
Okay.
Let's
Oh,
do
okay,
it.
it's doing it. Okay, laugh.
So you have. This is the rhythm strip.
Oh, look at that.
You have now. You have one AVR. This is like I said the test. The test.
That's not fair. You can't just tickle.
Oh, it's inverted. Oh, what happened there?
Oh, that's very.
He died.
There's a negative.
Uh-oh.
Save it.
Am I dying? Doctor, I don't want to die. What are you doing?
See if I make any difference.
Why did it
Normal QRS.
invert that like that?
There you go.
Looks good.
It is good.
Negative.
Sorry, Eddie, you died a little bit.
Okay.
How's it
So
look,
this
Dr.
one here, okay, what we do is if you have the ECG looking like this, okay, because some machines will print it out this way, a big,
Big sheet.
all the sheets there. So what we do here is we cut, the technician cuts it and pastes it in the proper order. So this one will be your rhythm strip, and then you have lead 1, AVR, V1 is not even in order, and then it's going to be like this way. Good. Okay. All right. So once we're done with that, we tell our patient. Okay. So before we run it, we tell our patient, can you keep still, sir?
Keep
When
still,
everything's
please.
done, then we now remove it. Okay. Remove everything. Okay. And then make sure. Right here. And then we make sure that we attach the electrodes to this one. Okay, so start counting.
Because we changed the other two.
Okay, so, and then we wipe down the patient. Okay, to make sure that there's nothing sticky.
Some don't.
Okay, any questions?
Most of them don't.
So you need to, like I said, you'll need to, when you're doing this, when you're doing the electrode application on the dummies, please reuse the strips or these electrodes, okay? If it's from a person, of course, then we toss it out, but that one, we can reuse it again and again. Okay, it's going to stick more to the dummies, because of course that does not have any toughness to them.
We don't have to interpret the reading the finding.
Oh, cause the last part, I will give you a strip to interpret.
Ah.
That's fine.
Will it be in colored
It's going to be huge.
and bigger?
Oh my gosh, I
So you have again heart rate, the rhythm, the piece, the PRI, QRS, and interpretation within
Okay.
20 minutes. All of that. So it's like you got it from the patient and you're now interpreting it.
How many points off is that?
Which one?
We get it wrong.
don't
For every wrong input,
point.
then less one. So if you did not get the PRI wrong, or if you got the PRI incorrect, or the QRS, then less one.
Point two. Points wrong?
What if we go
Never
over
mind.
time?
No, you can't go overtime because when the bell rings, let me have all of that.
Okay.
I'm not going to allow you to proceed.
Is it gonna be repeated or everyone's having the?
No, it's going to be a different one for everyone. So if somebody chose, somebody picked heart peripheral vessels EKG,